Hi guys. So today what we're going to talk about is IT band syndrome or runner's knee. And usually that's the case where people have problems down the side of their leg here. They're complaining about a lot of tightness and strain going on anywhere from their hip all the way down to the side of their knee here. This is also going to be combined to issues with runners, of course, who have pain here or too much strain around their knee every time they take a step. So usually the case, it's bad mechanics as far as their movement here, because usually as they take a step in different activities they do, we'll just think about a runner right now, their knee usually falters into a valgus position, or the knee kind of comes inward, putting a lot of strain on the outside of their leg, and they'll even feel it not only in their thigh, but into their lower leg on the outside of their calf here. Usually that's a sign of areas of weakness they need to work on to improve their mechanics to keep everything in line. So it's a little bit of strengthening, a little bit of motor control to gain that stability back of the hip. And of course, with all that tightness here in the beginning, you got to work on stretching all that back out to help you get mobile to do the activities that you want here. So there's a couple different self-tests you can do without always having a physical therapist or doctor to assess you to know if you have a bit of a strain or IT band problems in the area here. So one thing you can do, well actually a couple things you can do is doing a squatting motion, a single leg squat, or going through a step down motion here. So to do some of the exercises here, to do a self-assessment, you might need to have somebody record you with a camera, or just use a mirror as you're going through the motions to see if you do falter with your movement here. So do it when you go through a squat motion here, as you're squatting down. Does everything line up as you squat down? And does your knees go right over your toes here? Does everything line up straight to where the weight distribution transfers nicely? Or do you find yourself dropping one knee in as you squat through here? Or even both knees kind of buckle in as you're going through this problem here? Some issues with that, as the knees buckle in, of course, is weakness that you have in the glutes, or just lack of control of using those muscles to come out. Or even checking your feet. If you have a bit of pronation in your feet, that might be something else, and we can talk about that in a later video, to work on, where your foot falters inward, to drop your knee into that position there. Another exercise you can look at and to go through is a single leg squat here. What you can do is, standing on one leg here, you squat down into a motion, going into kind of a skater's motion or into a running motion as you go into a squat. And again, does your knee line up over your toes here and staying under good control? Or do you find yourself dropping your knee inward and of course adding undue stress into the side of your leg or the places you've complained about having a problem there? If you do the exercises, again, go through about 5 to 10 reps to see if you have the control going through from one rep to the next, or if it starts straining too much, just stop after a few reps if you're starting to have a problem through there. Okay, so with a step down motion, what you want to do is stand on the block that you have. We've got, again, about 4 to 6 inches is probably fine to tell you where you're at. Again, stepping down with your leg you're not looking at, and see if you step forward with that knee pretty much in line with your toe, or as you go down, does your knee falter inward? Again, if it falters inward and it shows a bit of strain, again, the side of your leg or even down into your lower leg, it means that you probably have some issues with your IT band, or, again, issues, what they call runner's knee. And either way, you'll need to work on some of these other exercises that we can show you to help improve, again, just the strength and control to get you back on your feet.